Hi guys, my name is Tim Jang. This is a poster on Xanthogranulomatous Pyelonephritis, also called XGP. XGP is a rare variant of chronic pyelonephritis in which recurrent UTIs and nephrolithiasis lead to severe renal parenchymal destruction. On pathology, these kidneys are infiltrated by huge numbers of lipid-laden xanthoma cells, an example of which you can see on the H&E stain on the top picture of the poster here. It's usually a disease that's diagnosed quite late in the course. It's often asymptomatic early on. Usually a radiologic diagnosis, primarily through CT scan. The differential, however, even through radiology is huge. It's often misdiagnosed as a renal cell carcinoma. The symptoms, again, can be very nonspecific, mirroring standard pyelonephritis all the way to a totally asymptomatic course until the very end. The only curative treatment we know at this time is nephrectomy. However, early recognition of XGP does have the potential to affect prognosis and management options, as you will see here. In our case, there was a 51-year-old male with a history of UTIs and nephrolithiasis who was admitted for altered mental status. CT scan of his abdomen on that admission demonstrated large right-handed Staghorn calculi with hydronephrosis, consistent with xanthogranulomatous pyelonephritis. This particular diagnosis was the second CT scan image you see on the poster here on 11/2017. Now, you can see that in a baseline CT scan from 2 years prior, the patient actually did have mild hydronephrosis and a small right-sided renal stone that was evident. However, findings were not nearly significant enough for this to be called XGP on radiology. This patient subsequently had a right-sided nephrectomy a year after his formal diagnosis of XGP, and you can see in the intervening time the hydronephrosis and nephrolithiasis in his kidney gradually worsened. He also had nuclear medicine renal scans that showed his kidney function continued to decline. His open right frank nephrectomy was quite a significant procedure for him. Thankfully, the patient did well in the postoperative period. Now, in our patient, these findings 2 years prior to his diagnosis of XGP demonstrating nephrolithiasis and hydronephrosis were significant because we have seen some other cases in which patients who are diagnosed early in their course did have focal or partial XGP, which was successfully treated with removal of nephrolithiasis and antibiotic therapy alone, suggesting that the disease process is tied to the nephrolithiasis and is not totally irreversible, at least in the early stages. Regardless, this disease is important to diagnose early and, if possible, prevent it from reaching the end stages. Complications, which include fistula formation, abscess, increased adhesions, and generally complications that would make surgery more difficult. Clinicians should be aware that in patients with recurrent UTIs, some of these small changes in imaging showing increasing nephrolithiasis and hydronephrosis may warrant more aggressive urologic management to prevent the evolution of XGP and subsequent complications and loss of kidney function. Further research is necessary to determine the early pathogenesis of the disease and to further stratify management options depending on the stage of disease progression when the disease is diagnosed. Thank you.